Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have two amazing guests to introduce to you now. Dr. Steve Hughlett has been a clinical pharmacist for over 30 years in the hospital setting. He has given numerous talks to healthcare professionals and enjoys learning and educating others. His God given passion has always been to help people with their health. This has led him to change his focus from treating the unhealthy to trying to prevent others from becoming unhealthy. Dr. Hughlett is the author of the book, Your Plate is Your Fate, a simple guide to understanding how your food choices lead to more and more medications. He is also the host of the Simple Healthy Choices for Weight Loss podcast, which is fantastic and full of very helpful information, especially if you are searching for answers to questions such as how to lose weight and keep it off, and if the ketogenic diet is right for you. Steve has been married to his beautiful wife, Theresa, who is actually joining us today for this discussion for over 35 years. They have two wonderful boys, Brandon and Skyelar, whom they love with all their heart. I was lucky enough to meet Steve and Theresa at Low Carb Denver 2023 and reconnect at KetoCon 2023. They are the loveliest and kindest people, and it is such an honor to welcome them to Boundless Body Radio. Steve and Theresa, welcome.
Hey.
Welcome. Thank you so much for having us
Yes,
on.
thank you.
So great to have you guys. It's so great to see you guys again. Like I said, I was lucky enough to meet you at Low Carb Denver. For this year's conference, I decided to kind of pony up a little bit more cash. You know, we just run our own like small business around here, so I don't have tons of extra money everywhere. But I decided to go to the VIP dinner, and I chose deliberately this year to, rather than kind of hang out with the people that I already know in the low carbohydrate space, I really wanted to try to find people that I didn't really know. So I was coming into the dinner. I saw you guys sitting down. I had no idea who you were. I asked if I could take the seat next to you. And we just had a wonderful dinner chatting and catching up. And it was just such a great time. So thank you very much for letting me crash your dinner.
Oh, that was wonderful. And we feel the same way. It's like all of a sudden we found a friend that we never knew we had, you know, and
Totally.
it worked out great.
Totally. It was great to see you guys also at KetoCon. And I asked you at KetoCon if you were still hungry from the dinner that we had in Denver. No knock on Low Carb Denver. Like, it was really fun, and I did the whole VIP dinner for the social aspect, and it's fine. But like the catering company who put the dinner on, definitely know who they were dealing with. They brought out this plate of salad, this tiny little plate of salad, to a group of people that are like mostly like not eating a ton of salad and eating lots of meat.
Mostly
And the
carnivore.
entree was just like little tiny piece of buffalo meat. Like,
You probably got 4 ounces.
Yeah. I think
it
a lot of
wasn't.
people went out to eat after that dinner.
I was one of those people. I was definitely not satisfied. I left there very hungry and had to go search out some food somewhere else. I love your work. I love everything you guys are doing with your podcast. The book is fantastic. And I was kind of reflecting on where to take this conversation today. And I was thinking primarily about a conversation that I had yesterday with one of my clients. He's an 18-year-old kid. He was asking me how to put on muscle. And I told him, like, look, you really should focus on protein. And I'm really glad that I gave him that advice. And then he asked me about vegetables. Should I be eating vegetables? And it's no secret here on this show that I'm a carnivore. I've been carnivore 4 years. We interview tons of carnivores. I don't think they're great for people, vegetables. So I go into this like 5-minute rant about how bad vegetables are and you should never eat vegetables and all this stuff. And I got in my car afterwards and I just like thought to myself, like, did that really need to happen? Like, that was something that I believe in, but is that like the hill to die on? You know what I mean? And I'm out on a walk this morning and I see a food truck that is donut kebabs. I can only imagine what donut kebabs are, but like, why did I take the time to explain all the bad things about vegetables when we live in a world where donut kebabs live? And this is why I love your approach and I love your message. You guys keep things really simple and approachable for people. Why do you think that's important?
Right. Because the main thing that's killing people is the man-made food. It's the processed foods, the things that are in box, bottles, bags, cans, down the center aisles. That stuff is loaded with vegetable and seed oils, which are extremely harmful, have like a 20-to-1 omega-6 to omega-3, which means you have much more inflammatory prostaglandins than you do anti-inflammatory, and we are walking around inflamed. Then they're loaded with processed carbohydrates, which keeps your insulin levels high. And that's the main thing with obesity is the people who are obese because their insulin levels are high. Because if your insulin levels are high, it forces you to store fat. Your body cannot burn its own fat. You can only store it. So the whole key to weight loss and type 2 diabetes, metabolic syndrome, and everything else is to keep your insulin levels low. And that's the way we used to always do it. You know, way back since the beginning of time. I mean, we didn't eat carbohydrates. That wasn't a thing that people did very often at all. And so we were able to keep our insulin levels low. But once processed food came out, that's all people do anymore. And so my big fight is not fight, but what I want to explain to people is it's not, all meat, all vegetables, how much about it. It just stick with God-made food and away from man-made food. And it makes it so much easier, because you get into the woods on some of this stuff. But in fact is, some people, they handle vegetables with no problem whatsoever. And we're actually that way. But we have been learning a lot more about the oxalates and everything that are in vegetables. And so it's like, that's not a battle I'm going to take. If you want to eat vegetables, eat vegetables. If you want to eat fruit. Just don't eat a whole lot of it because of, other things, the insulin levels and everything. But, and eat meat, eat lots of meat, because most people don't eat meat. And now we're fighting against the food marketers out here who are trying to tell everybody that meat's bad and you got to eat their carbohydrate laden stuff that they sell on these shelves. And people need to realize that is marketing. That the food company is not here to make you healthy. The food company here is here to make money. It's a business. Food company, drug companies, they're here to make money, and they actually make a lot more money when you're sick,
Right.
and when
And
you're
then
hungry.
I think sometimes if you start, and this person you were talking to yesterday may not have been that way, but it's like sometimes, like if you start telling people you can't eat vegetables either, along with everything else, it's so overwhelming. They're like, what, really? I can't even have that? So it's like, no, just try to give up all those processed foods.
Yeah, no, that's such a good
I
point.
mean, people, because that's a progression, like you hear people kind of doing the keto or whatever, and then next thing you know, they're weaning off the vegetables. They find they feel better. And so that's just a process I think people kind of end up doing, or at least in our world,
Yeah.
the
Yeah,
keto.
exactly. And I need to remind myself that all the time, because I love those complicated discussions. I could sit at Low Carb Denver and listen to lectures about subfractions of cholesterol molecules and the latest studies, and I can hang, like I've done this long enough that I can hang with that kind of thing, and it's not over my head. But that is after 16 years of being a personal trainer and nutrition coach and obsessing about this stuff forever. I need to remind myself to do what you guys do and just keep things a little bit more simple. So I love
Mhm.
that answer. I love the way you guys explain that. Before we talk about what we're going to get into today, can you share your stories of how you kind of ended up dealing with the things that you do now?
Well, with me, like I said, I was a clinical pharmacist for 30 years. I've been a clinical pharmacist for about 32 years now, and worked in the hospital setting for about 29 years. And the first half of that, I was in pediatrics, because that's what I did my residency in, was pediatrics in Charleston, South Carolina. And then I moved over, and the last half, and I was a supervisor. When I was on peds, we came up with this annual pediatric seminar that we did, where we brought physicians and nurses and respiratory therapists and dietitians and first responders and everything in once a year for a total all-day seminar. And I talked at three or four of those in the first half of my career there or at the hospital. But the last half, since I was the supervisor of the first or second and third shift, I went to the night shift. And so I kind of lost touch with a lot of the pediatrics. But still, about 4 years ago, they contacted me and asked me if I wanted to talk on childhood obesity. And I said, yeah, I would. So I went and I put this talk together about all the same old horrible information, because I didn't know. That's all I knew at the time was that, you need to eat low fat, high carb. You need to, if you want to lose weight, you need to exercise more and decrease your calories, and then talk about the food pyramid and, all the stuff that's wrong. And then I thought I better go back to the literature and see if there's anything else out there. So I did. And I found there was a ton of information out there on nutrition that we just don't know. We weren't taught it in school. Physicians aren't taught it in school. Nobody knows. And then a lot of things that you're taught is things that are funded by the drug companies and the food companies. And so I totally changed my talk, gave the talk. And after the talk, I had several people coming up and to me and saying this was all brand new information. They loved it. It made perfect sense. They thought I should write a book. So I wrote a book thanks to my wife, because she took my talk and she just had it put down in through
Fiverr,
Fiverr, and they just went through and they
transcribed
transcribed the whole book for me. And I got it back and I looked at it, I thought, shoot, this is almost a book here. So I just went through and started adding to it. So that's when we got the book, and then got the book out, and then started this podcast. But the main thing is there was so much good information that I think people are so confused by all the different diets that are out there, all the different ways of eating the diets. And I just wanted to say, stop, Don't worry about all that stuff, whether you should be all meat or all vegetable or a little bit of both or high fat, low fat. The main thing is just stay away from carbs. I mean, that's really kind of the big thing, keeping your insulin levels low. But once I started doing that and started talking to people, and we actually did a little free little thing in January, and we had several people that just in that first month, they lost on the average around between 20 and 30 pounds. And they felt great doing it. That's the whole thing. Because if you eat clean, that's how you know. If you're eating clean, if you're eating the way you should, and you're drinking water and you're trying to get your sleep, you're going to feel good as the weight comes off. You're just changing from eating carbohydrates for your energy source to letting your body eat your own fat away for its energy source, which is much quicker, cleaner burn. But so that's kind of how I got it. And I mainly got into it because Theresa, she's been into the nutrition and exercise. She's always telling me new stuff that I need to do.
Right. Yeah.
So who do you like?
Well, I think what the big thing with us was, back in 1999, we did, I don't know if you've ever heard of Bill Phillips, the Body for Life program.
Oh yeah, Body for Life was huge. Yeah.
Oh my gosh. So we did that and we just had great success. I mean, I think I lost 10 pounds and you lost 25.
Probably.
He did really, we both did really well because our body, the shapes just changed, especially mine. But that really got some things rolling. So it was kind of always in the back of our mind because Steve ended up going into the night shift, and we thought we'd do something during the day, but that just didn't work out because kids were little and we just focused there. And then once they were gone to college, that was when he was asked to do that talk, and then it just kind of all
and
took
actually
off from there.
Even me switching from being a peds pharmacist into the night shift supervisor or second, third shift supervisor, the reason we did that was for this exact same reason. We wanted to teach people how to get healthy and how to stay out and just prevent getting on medications. And if you're on medications, you can get off them, because most medications, they don't treat anything. All they do is they act like a Band-Aid, and they just kind of mask the symptoms of most stuff. Your blood pressure medicine, cholesterol medicine's crazy, but glucose medicine, I mean, all these medications, they fix one thing and then they mess up a lot more, especially with diabetic medication. Most diabetic medication that you take for type 2 diabetes actually makes type 2 diabetes worse, because most of the medications, it works by increasing your insulin levels because they're trying to get your glucose down, your blood glucose down. That's the worst thing you could be doing, because high insulin levels is what you got there in the first place. That's why you have insulin resistance. That's why you're storing fat. That's why you can't burn your fat. And so the trick is to keep both your glucose levels low and your insulin levels low. And the only way you can we can't do that as pharmacists. If you have high blood glucose, that's all we can do is give you medication to produce more insulin so you can get it down. But for the most part, 95% of the medications that are used are that way. So that's why it's like, we want to get people from being on there in the first place. And once we did that, the Body for Life back in 2000, we realized, oh my gosh, this is really possible. And now that I've started learning all the nutrition information for the last 3-4 years since the talk, it just made me more and more passionate about really trying to get the word out there, because it is crazy how many obese people we have. And being in the hospital with COVID, oh my gosh, it was by far the majority of the patients who died were patients who were obese, especially if they're less than 65. If they were less than 65 or 60 years old, the most common reason is because of obesity. That's why they were dying, because of all the inflammation that fat cells, put into the body is a lot of it. And so now you've got an inflammatory virus with an inflammatory nutrition habit, and your body just can't handle that kind of stuff. So anyway.
I've had multiple people that have been in ICUs during COVID that said they did not see one single patient who didn't have comorbidities, that didn't have obesity or hypertension. One person said they did, but everything was just undiagnosed. They hadn't noticed it yet, but this person clearly had metabolic dysregulation.
Yeah. It's horrible.
Wow.
So, I mean, now that we've found, I really do think this is the cure. This is what will do it. And that's why I like within our podcast and in the book, I try to really try to explain it in as simple terms as I can. But you are talking about nutrition and how the body handles all the different foods and everything. But it just makes so much sense. And when you see all the obesity that's out there and all the medications, it is unbelievable how many medications a lot of people take. I mean, they're coming in, they're getting their medication filled every month for, seriously. I mean, I'm not lying. We've got people who have 15, 20 different medications. I have no idea how they keep it,
Keep
all
track of it.
clear. Yeah, how to keep track of it.
Mhm.
And all the adverse effects. Every single medication fixes one thing and it messes up so many others. So that's why you get another medication to take care of that. And all of this could be totally stopped if you just gave your body the nutrition that it needs.
Wow.
And that's the best way to fight any kind of infection, is give your body the nutrition it needs. Our bodies are magnificent in how they can fight all that stuff. It has for centuries.
Yeah, totally. I don't know if this stat is still true or if it ever was true, but I heard that for every dollar we spend on a primary medication, we spend like $1.83 or something on the medications that deal with the side effects that came from the primary medication.
That's right.
I bet.
Oh,
That's
yeah.
ridiculous. If that's true, that's ridiculous. That's
Oh, it
crazy.
is. Oh, it is very, very ridiculous. And I mean, the system's messed up. I mean, it really seriously is. The whole medical system's messed up. And I think people are more aware of that now since COVID. But it really is. The doctors don't have enough time to spend with patients. I mean, because now you've got corporations who are over you, and it's a business. So they're monitoring, how much time you can spend with each patient and all that. And doctors don't have enough time to sit here and explain all about your nutrition and how here's the way you should be eating, and this will help you stay off this medication. They don't have time for that. So all they do is say, oh, you're having trouble here, then take this medication. Oh, take this medication. And it becomes a monster, and people suffering from it are the ones who are taking the medication. So I want to let them know that it's a choice. Either take medication, you spend all your money on hospitalizations, doctor bills, pharmacists, or you can spend your money on nutritious food. And if you're doing it right with time restricted eating or intermittent fasting, you're not eating that many meals. So you really can do it for a lot cheaper. People think, oh, it's so expensive to eat healthy. It's like, no, it's not. If all you're eating is meat and you only do it twice a day, you're going to stay full. You're going to stay full the entire time, and you're going to keep your insulin levels low, and it's going to be a lot cheaper.
So much cheaper. Yeah,
Yeah.
everybody's complaining about egg prices, and it's like I can eat 20 eggs on a weekend day when I have enough time to scramble them up, and like that's a few bucks. That's not that expensive. Even if I'm buying local from a farmer, they're a little more expensive. They're not prohibitively expensive. It's not that big of a deal.
Oh,
I love that.
no. I mean, no matter how expensive the eggs are, how much is that compared to, which I honestly don't know. We don't go to fast food restaurants, but I mean, how much is that compared to a Whopper or a Big Mac or something like that? I mean, eggs, you're going to get so much more nutritious meal. You'll probably get, well, it depends on, we probably get 2 meals out of a dozen, but still it's a heck of a lot cheaper than going to the McDonald's and getting 2 burgers and fries and whatever else everybody, and then have your cookies and crackers and chips and everything in between those meals. And
So true.
people need to realize how that stuff is truly, truly killing us. It's tearing our bodies to pieces. And you can just look around and see, especially where we are. We're in Missouri. Where are you?
We're in Utah, just outside of Salt Lake. So it's just the same.
Oh, that's right. That's right. That's right.
You go to like the Costco parking lot, and every handicap space is taken, and there's more people riding in scooters than there are like walking around, it seems like. And it's hard. Like it's a fun game for me to go in there and see. Let me count how many people like at least look obviously metabolically healthy. And it's like playing Where's Waldo these days. Like you can't find them. It's crazy out there. Yeah. Okay, so it is sad. So I remember the Body for Life. Body for Life, was that the name of it with Bill Phillips? Okay, my dad did the program. I remember it well. I kind of have the association with that, but the same way that I have like the kind of second big wave of Atkins that kind of happened around the same time, where it was like, yes, it was higher protein, yes, it was a version of low carbohydrate, but people were like so kind of fat phobic at that point in the late 90s that they were only eating like chicken breasts and lean fish, and they'd lost weight, but they were really grumpy or they weren't able to maintain it. So I'm wondering for you guys, like, how did that evolve until the point where you were kind of getting into the more like low carbohydrate kind of / ketogenic space, where it's at least like paleo leaning or whatever?
Well, a few years ago, I don't remember her name. I found somebody and she was talking about low carb, including butter and all this fat. And I was like, what? I've never heard that.
She's talking out her mind.
Yes. And so I remember I made my son, my youngest son, he's probably 8 or 9 at the time, made him scrambled eggs. And I I scrambled them in butter. And he goes, yes, and we had the yolk. It wasn't just egg whites. And he was like, these are the best eggs I've ever had. And I'm like, evidently butter's good. So it was like, so that was, I don't know, probably easily 10 years ago, probably 10 years ago.
Yeah.
And just the internet and just kind of figuring it out there. But, when we did Body for Life, I know I personally, and I think Steve was too, I was hungry all day long.
Starving. And we ate like every 3 hours and we were starving.
I just
now
would
I eat
like
once a
look
day
at
and never
my
get hungry.
watch and just be like, when do I get to eat again? When do I get to eat again? So it was like, so this has been, and I just think this is so much easier because when we would talk to people about what we did before, and we had people that would do that program, but it was huge to eat 6 times a day. And now we're just like, if you could cut back to 2, sometimes, I don't do as well on the OMAD. Steve does. He can do that pretty well. He can do 1 meal a day, but it's like, this is so easy. And you're not as hungry. I just remember being hungry all the time. But about 10 years ago, I don't even remember her name, but I just kind of started seeing things online, lower carb, but it was never like carnivore or keto, but it was the lower carb.
But that was what me really look at all the different diets there is, because we were eating every 3 hours. We eat 5 to 6 times a day on Body for Life, and we worked out and we did lose weight, and we didn't feel real well. We didn't feel horrible, but like I said, we were hungry all the time. But it made me think, it's like, why did we lose weight when we were eating that many times, and now we're losing weight when we're just basically eating once or twice a day? And what it was everything I'm saying. It wasn't that as much as it was what we weren't eating. We stopped drinking the pop. We stopped eating the crackers. We stopped eating the cookies and all that kind of stuff. Everything in the inner shelves. We truly, we shop the perimeter if we're going to shop really right now anymore. If we're going to get, any meat that we get, we just find a local farmer and we just buy a side of beef. We're going with some friends and buy a whole cow. If we're going to get our fruits and vegetables, we're going to go to the local farmers markets, because that's when you buy them in season, as you should be doing it. You don't have to worry about all the glyphosate and all the stuff that they're sprinkling on. They spray it on anything that has wheat, corn, or soy in it. It just has glyphosate all over it, and it's horrible. And but I think that's why we figured that's how a lot of people are going to lose weight on a lot of diets. But I think it's because of what they're not eating as much as it is what they are eating. And if they stop drinking, because sugar is horrible for your insulin levels and your whole body. And the worst way to put sugar in your body is by liquid sugar, fruit juices, soda pop. I mean, all that is just horrible. So once we quit that, and once we stop snacking all the time, we don't snack or anything like that anymore. I think that's why we saw the big change with Body for Life. It kind of woke us up to how bad that stuff is. And now just the stuff we're learning now, the nutrition we're learning now, just solidifies it just crazily to how horrible that stuff is. So that's kind of our deal. It's not so much, it's more what you need to stay away from, if you want to stay healthy.
Gotcha. Well, that sounds like I might lose a potential sponsor here, but it sounds like I might need to pitch all my Sunny D that I keep in my fridge because it's got like vitamin C and it looks orange. Again, I don't think they're going to sponsor the show anymore, but I guess I'll have to get rid of that. Steve, I want to ask you about the presentation you were making. Again, it was pediatrics, right? For people who treat kids.
Right.
Okay, I want to know how that presentation changed, what things you presented on recently, what were some of your key points? And I want to contrast that with a podcast episode that somebody shared with me a few months ago that I have listened to 5 times now because I cannot believe what I'm hearing from people out there as far as childhood obesity. So tell us, if you don't mind, what were some of the key components as of what you were presenting to the pediatrics?
That was a lot of it is it kind of started off, I kind of explained a little bit of history of processed food, but it all really started back in 1955 when President Eisenhower had a heart attack. And back then people didn't have heart attacks. Nobody knew what that was. This is a new phenomenon. People don't really realize that all the heart attacks we're having, this is all new stuff. And it sent out a couple of people to find out. One was Ansel Keys, who said it was fat, which was totally wrong, had a horrible 7-country study that has so many flaws in it, but he was very, very persuasive. And then there was John Yudkin, who he said it was sugar, said the same things, but since Ansel Keys was more persuasive, he's the one who came back and he did this 7-country study that was so flawed and said that it was fat. And then it just kind of progressed from there. And I actually did a podcast on that, on just the history of processed food. But
Can I just tell the listener real quick,
sure.
after this episode is done, go onto your podcast and listen to episode 25, where you present the complete history of processed food. That was magnificent. One of my favorite episodes. My favorite episode is with the two of you on together on your last one.
Yeah, that
Was fantastic. Episode 25, all about the history of processed food, is wonderful. We'll tag it in the notes.
Oh, thank you. Yeah. But that's kind of what started, is like, we haven't eaten all these carbs forever. You just don't really think about this as some new thing that's come up. Never had all the disease we have, never had type 2 diabetes. Type 2 diabetes used to be called adult onset diabetes, because you never saw type 2 diabetes in children. It just wouldn't happen, because it's something that usually takes 20 to 30 years, because that's all the horrible food that you're eating that causes your insulin levels to be high. But now kids are starting off, now even baby foods, which I hate the way drug manufacturers trying to make people think that baby foods that are nothing but chemical laden, and they have some of them have up to 50% high fructose corn syrup in it, which is horrible. That's why we have this epidemic of obese 6-month-olds now. But they're trying to tell people this chemical laden, artificial flavors, artificial coloring, artificial sweeteners, all these other chemicals are in this thing, and they're telling people that this is much more healthy than breast milk that we've been having since the beginning of time. It's absolutely ludicrous, and people have to realize, just because they're a food manufacturer doesn't mean they care about your health. And they're out here trying to promote health. They're out here to make money, and you got to be aware of that.
So what, you had just become a pharmacist, right? Whenever they had that very first, was it a 3-year-old or a 5-year-old that was diagnosed with diabetes?
Yeah. 3 years old, 77 pounds, was the youngest kid ever diagnosed with type 2 diabetes.
And that was when he was very first. So that was, 30 years ago, basically.
And then that's where she doesn't have it anymore. She got rid of her type 2 diabetes because they took her off her sugar sweetened beverages and took her off of all of her processed food. And that went away, but she's lucky that they intervened that quick, and hopefully she's not that way now. I have no idea how she is now, but so that kind of started the whole thing when I started looking. Okay, because there's so many different diets out there. It's like, how do you know what one's right? So that's when, now reading through all this stuff, it's getting into me. It's like, oh, so look at how does your body handle food, and when you eat protein, your body breaks it down into amino acids and puts together. You have 20,000 different proteins in your body, and some of them are up to 27,000 amino acids long. And there's only 20 amino acids. So they put them together in all these ways, but our body needs them so much. And that's your meat. That's where you get your meat. It needs good, clean energy. That's your fat. That's why we have subcutaneous fat all over our bodies. And we just have a tiny little 10% of our liver for our carbohydrate stores. That's why people now, if they get, they think about skipping Miller, like, oh my gosh, I'll get hypoglycemic and I'll die. And it's like, it's because you're a carb burner. You've trained your body to use carbohydrates for its energy source. You need to switch back over and start using our fat the way God made us, and use that for our energy source. You won't do that.
They're addicted.
Oh yeah, they're super addicted. That's another thing I'd go into is how sugar you actually truly do get addicted to sugar. It's because of the bacteria in your gut does it, and also the nucleus accumbens, which is your pleasure center in your brain. It actually gets stimulated by sugar, and it actually becomes resistant to it. So it needs more and more sugar to give you that stimulus. And they actually think that may have a lot to do with the people. Yeah, I'm digressing, but there's a lot of stuff that you'll notice you'll get fixed just by eating clean, getting away from carbohydrates, and keeping your insulin levels low. But depression, Alzheimer's, type 2 diabetes, cholesterol meds. That's crazy. The people on cholesterol meds, and cholesterol has never been proven to cause cardiovascular disease. It's sad. It's sad that people are believing all the stuff's being put out there. So you got to just kind of take the information that you get and kind of use a little bit of common sense with it. And processed food is not a common sense thing to eat.
Yeah.
Or too sad enough it is. But if you know what it's doing inside your body, you would not want that in your body.
That's right. That's right. This is why I'm not going to be able to tell you how the donut kebabs are because I'm addicted to sugar. And if I had one, I would have another and I'd have another and I'd have
Oh,
another
exactly.
and I'd have anxiety through the roof. And so that's a primary reason why I choose to do a carnivore diet. I can just skip the whole thing and just focus on meat and I'm fine.
Yep.
Okay. All of that was amazing. I'm so glad you're presenting that. This is coming from a podcast. It's a major, major podcast. I think it was the Daily. I think the New York Times does it. So it's one of the most popular ones out there. Came out a few months ago. Somebody sent this to me because they thought it was ridiculous. Like I said, I've listened 5 times. Things they got right, like really called everything pretty well. Didn't have a lot of childhood obesity in the 60s. Started to increase in 70s and 80s, and we started to get more and more and more obesity. We don't really know what's going on with childhood obesity. So we actually did a study. We went into schools and we told them everything that we thought was going to help the school system be healthy. So they promoted fruits and vegetables, they promoted more exercise, and they noticed there was no difference in the two schools. Childhood obesity now today is a massive problem and we need to
Mhm.
deal with it early. Okay, all of those things, I'm nodding along and this all sounds great. Where it turns, since we told everybody what we thought was going to be best, and there was no difference between the schools that we gave them what we thought was our healthy advice versus the schools where we didn't do anything, there was no difference. Therefore, childhood obesity is genetic. We are now recommending
Oh,
that at age 2, because childhood obesity is such a problem, at age 2, we're recommending about 26 hours of therapeutic intervention, like counseling is what it sounds like, that will not
oh,
be covered by insurance for the 2-year-old and his family. It kind of invasive sounding type of therapy, again, not covered by insurance. We're recommending that kids be given Ozempic and other weight loss
oh
meds
God, that's
at age
horrible.
12, at age 12, and at age 13, we're recommending surgery, bariatric surgery for kids.
Oh my gosh.
5 times. I've listened 5 times because I'm like, how do you know exactly what the
Yeah.
problem is and how it's progressed? And everything that you explained about the change in diet, which is recent, is
Yeah.
affecting our health. And they're going on to say it must be genetic and we have to deal with it with therapeutic interventions at a young age. I've lost my mind.
Yeah.
Yeah. This is, and that brings up two things. One, back in, and this was done through the NHANES study. It's a nutritional long-term study they did back in 1950, somewhere in no, it was 1980. In 1980. So from the very, very beginning of time through the centuries, all the way up to 1980, our total pediatric obesity rates was 5%. From 1980 to 2015, so 35 years later, our obesity rates in pediatrics I think it's like 2 to 5 years old, it had gone from 5% up to like 10%. Well, it doubled. It doubled for those, then it tripled for the kids that were for like, and I don't remember the ages, like 7 to 9, 7 to 12, something like that. And it tripled for them. And then in the patients that are 12 years old and 19 years old, it's quadrupled. It's up to over 20% is the obesity rate now. And just 35 years ago, it was only 5. That proves this is not genetic. This has nothing to do with genetics. What else came out around that same time? Processed food, because that all started in 1977 when Senator McGovern came out with the new dietary guidelines for the United States. That happened. And after that, our obesity rates, our type 2 diabetes rates, our metabolic syndrome rates, everything skyrocketed. So that's where you got to come back and do common sense things. And you were talking about Ozempic. The problem with Ozempic, there's a ton of adverse effects. I've got a talk I'm getting ready to give in Virginia at the end of July, and I have 3 full slides of nothing but all the adverse effects to all those glutides, basically, because Ozempic's not the only one. But they have all these adverse effects, including thyroid C-cell tumors. But the thing is, the way it works, the way all those work is, one, it keeps the food in your stomach for a longer period of time. That's why everybody's taking it. But the other things it does is it increases your insulin levels, which makes diabetes worse, and it stops your liver from being able to put sugar into the bloodstream. So it blocks your glucagon levels. And by doing those 2 things, you're actually making diabetes worse. So I guarantee the more people and the only reason they're doing this is because they're saying it helps them where they're not hungry anymore. It's like, that's the exact same thing that protein, that meat and fat do. When you eat a diet of protein, of meat and fat, and that's sitting on your stomach, that will stay in your stomach for a longer period of time, which is what these people are wanting. And then once it gets out of your stomach and it goes through your intestines, you have two different hormones that are secreted from the intestines. You have cholecystokinin and peptide YY, and those are stimulated by fat and by protein in the intestines. When you stimulate those, both of those hormones go up to your brain and tell your brain, it's the medial hypothalamus, and say, I'm not hungry. So when you eat protein and fat, you stay satisfied for hours, for hours. Carbohydrates don't do that. As soon as carbohydrates go in your stomach, they go into your intestines, they get immediately shunted over to your blood. Most of it gets turned in directly into fat, and now your insulin levels are high, and so now you're telling your body to store that fat. It makes no sense. So when you take an Ozempic, you could stay away from the money that Ozempic costs, stay away from all the adverse effects, multiple adverse effects that Ozempic costs. Just stop eating processed food and carbohydrates and stick with meat and fat, and I guarantee you're going to get the same effect, and you're going to feel great by it. That's my soapbox.
So well explained. I love that. My wife is also carnivore. I literally make her an entire brisket every single week that she eats herself. I get a taste of it, and she takes it down herself. We went to a Brazilian steakhouse, which they know us by first name at this point. They know we're going to sit down and we're gonna have a good old time. And you're right. Like the level of satiety that we get to at an all-you-can-eat meat place. I literally had a piece of delicious ribeye in my mouth at the end of the meal that I could not even bring myself to chew anymore, and I had to spit it out. I knew that would
Right.
horrify me the next day, but that's how powerful those satiety hormones are. They literally make you stop eating. And I didn't even consider food for like a 24-hour period. To do OMAD was super easy because we focus on the right foods and we get really satisfied, regardless of what other things people want to include. If you're just focused on the fats and proteins, like you said, you're going to be just fine. So anyway, I'll send you that episode of the podcast. I hope it horrifies you as much as it did me. Sounds like it will. And I love your alternate explanation that no, this is not genetic. We can look back on pictures in my Formula One history book and see that nobody really had bad genes back then. People looked very thin and very metabolically healthy.
Yep.
So, okay. So I mentioned that you guys recently did a podcast episode where it was the two of you together. You were explaining some really simple things. Theresa, you did an amazing job on that podcast. I understand we were talking off air that you were maybe a little bit nervous. It didn't come across as nervous at all. You did great. Steve, I don't want you to take this personally. I might burst your bubble here. You married up. I'm sorry
Oh,
to
I
break
know
it
that.
to you. I'm sorry. No surprise that it was her idea to do the presentations and to write the book and to start the podcast. And first episode, she's knocking out of the park. I apologize. You might get angry. I just want you to know you married up.
I'm leaving
Anyway.
now.
Anyway,
I wanted to. I'm told by everybody that knows us.
Okay. I'm not the first person to break this to you. You guys made so many good points in that episode, and I was wondering if we could maybe cover some of the simple things that people could do to start to turn their lives around, whether they're just getting started, or maybe they've never heard of this, or maybe they are on this path and they are just wanting to, unwind themselves from all the minutia that we, really love to talk about, but in the end just kind of becomes like noise. How can we keep things simple, and what simple things did you guys promote in that episode that anybody could take and apply in their lives in a really simple way?
So like we're talking about with all the processed food, it's like people are just addicted. And so I think one of the things we tried to at least say in the podcast was that it's not easy. We're talking, it's just like, just eat protein and fat and, it'll all be fixed and you'll lose your weight and you'll be healthier. But it's like those first few weeks for somebody that's truly addicted and obese, because, Steve's pharmacist sees lots of patients that are on medication. They're really, have over 100 pounds to lose. And so it's going to be it's a struggle. And so what we try to get people to do is to really kind of work on their mindset, because they have to change their mindset about this, so changing their food, giving up that processed food, and knowing that they're going to go through some sugar withdrawal, the flour withdrawal, all that stuff, and planning ahead. So we do a lot with planning ahead. Plan your meals the night before, maybe shop the weekend before, and then just kind of making a promise to yourself. I think our lives are so easy anymore that we just don't try to do anything hard. And this is hard. If it wasn't hard, nobody would be overweight. Everybody would be like, okay, this will be easy, we'll just lose weight. So we really focus a lot on planning ahead.
Tell them about your why.
Finding your why. So why do you want to lose the weight? Some people really don't. They just don't, the food is their food. Food is their life. I mean, I don't mean like keeps them alive, but it's just like, oh, what are we going to do for dinner? Oh, you go on vacation. What are we going to have for breakfast and for lunch and for dinner versus all the things you can do on your vacation? Everybody's focused on the food. And so anyway, so it's just a lot of mental work that we also try to do.
And since the why is so important, that's why I try to get into it with the medication. Hopefully that's going to be enough of a why to try to get people off, because, even though a lot of people take a lot of medication, they really hate doing it. They hate paying for it, but yet they don't hate it enough to change their nutrition. And my hopes is that they do hate enough to change their nutrition. They just didn't know how to do it because of all the diets out there. And that's why we're trying to make it easy, saying, don't think of it as a diet, think of it as a lifestyle change. And the main lifestyle is stop eating processed foods, increase your water intake and good sleep. And then the exercise, like Patrice's kind of been talking about.
Oh,
exercise, movement.
And movement. Yeah, we're going to be having a video or doing a podcast on movement, because we have people that are, another thing is we don't really, if you've been working out, keep working out and then, incorporate, whatever the program that we have. But if they're not working out, we just are just like, don't even worry about it. Let's just get the eating under control. Let's work on that right now. If you can walk, go for walks, but
walking is great. If you can walk, if that's all you can do is walk, that's fantastic. Just measure how far you can walk and slowly increase, every day or whatever, just walk a little bit further. And there's so many good things about, in fact, I just did a podcast on the lymphatic system, which a lot of people don't even know what the lymphatic system is, but that's something that if you don't walk, you're not going to be moving your lymphatic fluid. And if you don't do that, you're going to be keeping a lot of the toxins and everything that are supposed to be cleared out of your body. You're going to keep them in your body. So movement just by itself is so important.
Right. So, right. So that is one of the things where it's like, don't be trying to, I've got to change the way I eat and I've got to start exercising. That's just way too much. But if you're already exercising, keep doing that. And then, if you can, dial in your nutrition, probably if you're already exercising, you don't have too much weight to lose,
Right.
Just,
and I go in and I explain that the podcast where I'm talking about the body weight set point, when really that's if you're obese and you're first trying to lose weight, that's really the worst time you could be exercising, because your body is going to fight you. As you start decreasing calories, your body's going to make you ravenously hungry. And as you start going down in weight, your body's going to try to get it back up to the weight it's used to. And so it's going to slow down your metabolism. So you're trying to eat when your body's making you ravenously hungry, and you're trying to work out when your body's making you tired. The key to that is eat meat and fat, and that will take care of your body trying to make you ravenously hungry. And then just don't work out until you start losing weight. And I guarantee once you start losing weight, you're going to feel better and you're going to have more energy. And that's when you're going to start doing whatever workout you want. But up until then, if you can at least schedule in time to walk every day. And then when you do have more energy, you want to start exercising. Now you already had that time out there, because a lot of people use exercise as the reason why they don't get healthy. Oh yeah, I'd love to get healthy, but I don't have time to work out. I don't have a place to work out. I don't have the money to work out. I don't know how to work out. And they just have all these things about working out. It's like, stop. You don't have to work out. Just pay attention to what you're putting in your mouth.
Yeah.
So that's
I love that. I love that. I'm a personal trainer. I sell workouts and I tell people the exact same thing. I worked on a metabolic cart for over a decade, and I got to measure firsthand what people's metabolic rates were. And if you did a calorie restricted diet and did a bunch of calorie burning activities, you would wreck your metabolic rate. I could measure it. I could see it. Even just somebody walking up the stairs, wearing a jacket in July, freezing cold, storing weight around the midsection, terrible energy, hungry all the time. Like your workout program and your diet is causing the rebound. You're going to rebound. You're causing it by doing all the right things that you think you should be doing.
Right.
It's going to backfire on you, and it's so sad. You guys are very deliberate with the way that you use your words, which I really love. The promise to yourself. I really love that phrase. We've interviewed another Hughlett, Jason Hughlett. He lives in my neighborhood. He wrote a book called The Promise to the One, and he talks about how important it is to make promises to yourself and to really phrase it that way in a like really deliberate way, so that you hold it more sacred in a way.
Uh-huh.
Right.
And I just wonder, as you guys are talking about your why, I've heard you on that episode talk about your personal whys. How
Mhm.
has that helped you keep the promise to yourself in certain situations where you could have eaten the donut kebabs?
Hmm. I try just to not even think about it. You just kind of just know that that's there and not even think about it. As far as my why changing, I'm not sure. I don't know. I think it just changes in the next, it's just kind of that way.
And in
Not
all
even,
honesty, I mine seriously is like you said, I am well aware that I'm married up, and I want to be the best husband I can be. I want to be the best husband, best father, best grandpa. And you can't do that if you're unhealthy. You can't get out and play with the kids. I can't take my wife to different places. We couldn't go, climbing mountains or scuba diving or whatever we want to do because of obesity. And I don't want to not do fun things with my wife and my kids. Now my kids are older now. We've got 26-year-old and a 29-year-old. Brandon's 29 and Skylar's 26. But even then, and they're both very active. They work out all the time, and they've gone through the nutrition thing, like we are. And now they're taking pictures of their stuff and send it to us. But that's my why is my family. I mean, that's my why. And drugs kind of are, except for I'm not on medications. I'm 61. I'm not on any medications. And my goal is I will never be on medications. It's just a downward spiral that I don't want to have. And you're talking about the um, donut things. That's one thing that I got out of this nutrition, reading all this stuff that I never thought about before, is that carbohydrates and fat both are used for energy. The fat is much cleaner. Carbohydrates are going to raise your insulin levels. And you never, ever, ever see carbohydrates and fat in God-made food. You're not going to see
That's
that
right.
in nature. Because when you eat a carbohydrate, it makes your insulin levels go up. When your insulin levels are up, now you eat the fat or whatever else, and your body is forced to store that because that's what insulin does. It's a storage hormone. That's why you're going to have your protein and your carbohydrates. That's going to be like in your fruits and your vegetables. And you're going to have your protein and your fat, like in meat, but never will you have protein and carbohydrates together, except for in all this man-made processed
fat.
food.
You mean fat and
Oh,
carbohydrates?
I'm sorry. Yeah, fat and carbohydrates. That's
Yeah.
what you see in the processed food. And that's another reason. So now they put all this crud in here. Now you eat it and it does what we just said. Your insulin levels goes up and it tells your body to store everything as fat. So I thought that was another interesting thing too. I just wanted to throw that in there. I know it was off
Yeah.
your question of the why,
No,
but
no, that's fantastic. I really appreciate that. Breast milk is a combination of carbohydrates and fat, but you're an infant. You need that. You need to be growing, and that helps you to grow. You're right. I wish more people would see it that way and understand that you really do not find that in nature. It does not exist. It's either fat and protein or it's carbohydrates. And I even think somebody could have a certain amount of some natural whole foods carbohydrates and kind of almost like just keep it separate. Like if you're going to have a piece of fruit, like that's fine, but then you could lean a little bit more towards proteins and fats for a bigger meal that would be satiating, like you described
Mhm.
before.
exactly.
Okay, fantastic. Your explanation on exercise and movement is wonderful. I love calling it movement. I think it's a really critical way to look at that. For the person who's starting to move, they're starting to walk, they're doing what you're saying, you're slowly progressing and doing a little bit further. Again, I think that's wonderful advice. For the person that has now turned their life around, they've got the better energy from changing the diet, getting the processed foods out, when they're starting to consider exercise, they've again feeling good. What types of exercise are you typically recommending for them to kind of think about?
Lift weights.
Thank you. Thank you.
Yeah. It's resistance training
Yeah.
by far. Running, running's fine, but running is really hard on a lot of people's body. You're really not going to get that much more than just walking. You do want to get your heart rate up, but by far there's so many good benefits to lifting weights,
Lifting
like
weights.
Teresa
Yeah.
said.
We're getting older, and especially us, we really need to be lifted. I mean, because our um, bone density and muscle mass is just shrinking
Insulin
every day.
resistance. I mean,
Yeah.
it's good with insulin resistance,
Yeah.
everything. Lifting weights is just so
Yes,
good.
it's good.
As long as
Yeah.
you do
Yeah.
it proper form,
Cool.
proper weights.
Yeah. So my opinion has changed greatly since the pandemic when I had access to a full gym. We lost that access when we became unemployed. For somebody who might tell you, like, yeah, that sounds great, but I can't afford a gym membership. So therefore, I'm not going to be able to lift weights or do any kind of resistance training. What do you say back to that?
Body weight.
Hmm.
Body weight.
Hmm.
That's all you
Push-ups.
need. You can do push-ups, pull-ups, sit-ups, You know, I mean,
Air squats.
air squats. In fact, as you get older, like Teresa is, she's starting to learn other things that we need to be able to do, like being able to stand and sit down on the floor and stand back up without using your hands. And when you're taking off your shoes and socks and underwear and everything, do it stand on one foot. You know, don't sit down to do that stuff.
Yeah, for balance.
Yeah, for balance. When you're brushing teeth, you're brushing your teeth anyway. Just stand on one foot, because balance and flexibility are the two things that really start going downhill as you get older. And that has a lot to do with a lot of elderly people will fall, and a fall could be very, very detrimental. It could be lethal. A lot of times people, they fall, they break their hips. Now they're in the hospital and they never leave the hospital. That ends up what
Game over.
Yeah. So having strength, especially strength in your lower body, or what, you need strength all over, because even if you start to fall and you can catch yourself, if you don't have strength, you're not going to be able to catch yourself. If you start to trip, you're not going to be catch yourself with your legs. I mean, so strength is so important with that. Also, as far as just things of strength, flexibility, and
balance.
balance. You know, just work on those things if you're older. But man, definitely if you've got to lift weights, and you'll feel so much better after you've been lifting. And like I said, body weight is perfectly fine. We got one of those little bars that goes across our door jamb. And so it's a pull-up bar. So we do pull-ups off this little, it's cheap. It just fits on the door jamb. We have it going right between our office and our kitchen, you know, just go by there and do some pull-ups every now and then, just little by little. You don't have to go out and be this great big, you know, workout till you die. You want to stimulate your muscles. You don't want to annihilate them, you know? So
Good point.
The best exercise you could ever do is the one you enjoy doing. Just pick one, the one you like, and do it. And the rest will it'll slowly come. It just morphs into that.
I love that.
I read a really good book. And that's what kind of started us on so when we go to sit down to watch Netflix, we'll sit on the floor for a little while. Because, you know, they're like, we just sit in chairs all day long and it's so bad for our hips. So we'll sit in the floor and it's like, oh, we got to sit in the floor.
But you sit in the floor, you're stretching your legs, you're flexing your hip muscles. So you're not leaning up against anything. You just sit flat in the floor and it's, it's not something we look forward to doing, but how sad is that? But really,
you're sitting in the floor, so you're.
Yeah, I've recorded every single episode of this podcast sitting on the floor, cross-legged. I've got my little toe spacers in, and like this glamorous podcast studio.
That's awesome.
But it's so good. If you haven't sat on the floor in a while, sit on the floor and see it. You think sitting on the floor, well, that's easy. It's like, it depends on what you've done to your body up until now. It's not that easy for a lot of people.
Yeah.
And this is the time to do it. Just little things. But even after 2 weeks, I've seen a huge difference in my flexibility just by sitting on the floor for the first half hour of watching Netflix or whatever.
I love it. That's fantastic. When the pandemic, was kind of starting and we realized we'd have to start our own company and everything, we were looking for a software program where we could give our personal training, programs and send them out to people virtually. The one I landed on, I chose because it made it really easy to filter based on what equipment people had access to. Some people had just whatever, like random hodgepodge, whatever they had in the basement that was gathering dust that they needed to dust off. Could have been health riders and thigh masters and whatever. Crap. And even then I can filter down to exercises with water bottles. Fill up some water bottles and do some curls. Or like recently I bought a set of 4 different bands, just simple rubber band loop things on Amazon, $30. I can crush myself by moving these simple bands slowly and challenge my muscles until I can hardly move. There's so many things that you can do if you're just willing to be creative, or get with somebody who knows what they're doing so that they can kind of help you along and guide you so that you can understand some simple things to do on your own. I love that you went there with that. Are there any other major lifestyle things that we've missed in this conversation that we want to talk about?
Enjoy life. Smile.
Thank you. Love it.
I mean, life is so wonderful, and there's so many people that were just devastated by the whole COVID thing and everything, and seriously, sugar addiction really, they do think that has a lot to do with depression now because of you get resistance in your nucleus accumbens, your pleasure center of the brain, And you're not just resistant to the sugar, you're resistant to all pleasures. And it is making a difference. But man, find something you love and do it. I mean, that's our thing, is just wake up and enjoy the day. Don't wake up and just think, well, I wonder what's going to happen today. Have it planned out. I think the whole trick to feeling good is setting goals. I mean, that's why you need to set goals. Set tiny, tiny goals, and then accomplish it. It's like, oh, that felt good. And you'll set another goal. Whatever it is, whatever you want to do, it doesn't matter as long as you, I mean, it kind of matters, but as long as you enjoy doing it and you're bringing happiness and you're bringing happiness to others, people need to focus more on that. And if there's something that you're doing that you don't enjoy, then change it. If you can change it, change it. I know that's a weird way to say it, but it just seems, it's weird how many people seem depressed anymore. But the group that we're around, the KetoCon low carb people, they don't seem depressed. Everybody seems happy. I mean, I just love going to those meetings because everybody, we think alike. They have energy. They're just like you, just like coming over and talking to us. And now here we're doing a podcast together. I mean, I absolutely love this kind of stuff.
Infectious. It's pure energy. It's pure happiness, openness, energy. And you feel everybody's like spirituality and gratitude. And it's so cool to think that like the being happy is predicated on the lifestyle things that, again, you guys make so simple. All of that stuff improves together. If you can start to fix some of these things, you will naturally be a lot happier. You'll tend to see things a little bit more on the bright side. You'll appreciate the birds flying around and butterflies and all the wonderful things that are growing in springtime like they are right now. And it's wonderful that all of those things run together. And it's so cool that you feel the same way about those conferences. I couldn't agree more.
And what happens is once you start getting healthy, you just naturally start hanging around with other people who are healthy. And because everybody knows that you pretty much who you hang around with within whatever they say, 5-10% are within about the same financial situation, about the same health situation. And that's why they say, if you're wanting to change anything, first thing you got to do is get a new group of people to hang around with. And it's so easy in the health field because people are vibrant. You're attracted to them because they feel so good. And all of a sudden, now you become one of those people that feel so good about yourself. You're attracting more positivity to you, which is opposite of the other way when you're just sitting around, you don't do anything but eat processed food, think about what your next meal is going to be, watch Netflix. You don't get off the couch. You don't walk. You're not around anybody. And that would have to make anybody depressed. So get out, move, and you'll see how you're going to start attracting other people to you, and it'll change your life.
Yeah, I love that. I couldn't agree more. That's probably why I chose the seat next to you at dinner, and I plan on hanging out with you guys for many, many, many years to come. This has been wonderful. Steve, I do have to say, like, you married up, but it's close. You're a sweetheart too. It is close. I just so much appreciate how you make this accessible for people and simple for people. And I appreciate you taking the time out of your day to be here today. Dr. Steve and Theresa Hughlett, where would you like people to go to find you and connect with you in your work?
You can go Dr. Steve Hughlett on Instagram and YouTube, Steve Hughlett on Facebook. I know it's a little weird. And then,
LinkedIn.
Of course, Simple Healthy Choices for Weight Loss is his podcast.
And then LinkedIn.
Oh, and LinkedIn. We're just starting on.
We're just starting LinkedIn. We're not familiar with
Dr.
LinkedIn
Steve
much.
Hughlett on
Good luck. I've heard that LinkedIn has like favorable algorithms. I always thought it was just a place to like post your resume or whatever, but it's this whole social thing. So good luck with that one.
Oh, thanks. So
we'll try.
Yeah, and then of course his book, Your Plate is Your Fate, and you can get that on Amazon.
And that's an Audible also. And I read for the book.
It's fantastic. I've heard that's like the hardest thing about writing a book is reading it out loud.
Yeah. It was different. Everything's been learning thing. Ever since I retired last year, October of 21. October of 21 is when I retired. And everybody said, "Oh, you retired. Are you bored?" It's like, oh my gosh, I have learned so many things with writing a book, doing the Audible for the book, starting a podcast. We're wanting to start a program where we actually can help people start losing weight. We're going to be working on that. Hopefully we'll have that out here in the next month or two. But there's no time to get tired. We've got or no time to get bored. We're learning something every day, and I absolutely love it because it's what I've always wanted to do with my life is teach people, get healthy, And now I used to think it's by putting them on meds, and now I know it's by not putting them on meds.
That's right. That's right.
So,
Well, I'm very, very glad that you suck at knowing what retirement means. I really, really appreciate your work and your energy. And thank you so very much for being on our show today. We really appreciate you
Thank you
both.
for having us
thank
on.
you.
Thank
We
you.
absolutely love this. Thank you so much. And we will definitely have
Absolutely.
you on our podcast as well.
Oh, good. I look forward to that. I really love your podcast. Again, you do such a good job being really choosy with your words and saying like there is a difference between simple and easy. We've talked about both, and some of these simple things are not that easy, but you still outline them in a very simple way that people can understand. So I never miss an episode. I really love it, and thank you for putting it out. It's fantastic.
Hey, thanks for listening.
Absolutely. Well, thanks again for being on this show today. We really appreciate you both.
Thank you.
Absolutely. And this has been another episode of Boundless Body Radio.